Now, there are many different types of flexion distraction tables. I prefer the motorized ones. You can see here as we activate the table and it goes into flexion, the motion occurring at the lumbar spine in this patient with her feet secured in the foot straps and her hands secured on the handlebars. Notice the motion of the lumbar spine as the table goes into flexion. See the position of the lumbosacral joint. And watch as the table goes up to neutral, where the position of the lumbosacral joint is. Then look at the superimposed image. Notice the distance, the separation or distraction occurring in the lumbar spine in this patient between full flexion and neutral. Now with just the table working, you can see the amount of distraction. Here we're going to show you how to place the hands to even increase the flexion, distraction, and separation of the lumbar spine. Now one thing I don't want you to do is to press from P to A, which will put the spine into extension. So we don't want to do that. We want the distractive force or your pressure from your hands to mimic the distractive force. One hand going inferiorly and the other hand going superiorly, which maximizes the decompression of the lumbar spine without placing the vertebra into extension, which is contraindicated in most cases. So in classical acupuncture, they talk about channels or meridians that flow through the body almost like blood vessels, and that carry the chi or the energy from areas of high chi to areas of low chi and keep a balance of energy within the body. So this diagram shows some of the meridians of the body. There are 12 bilateral meridians left and right, and 2 that are midline, one on the front of the body and one on the back of the body. And in traditional Chinese medicine, most of these channels are named after internal organs. And there's a loose relationship between, say, the stomach meridian and the organ in Western medicine as we know as the stomach, or the heart meridian and the actual heart pumping blood in the body. So take a few seconds to look at these meridian or acupuncture channel maps. We're going to see if there's a Western correlate to these traditional channels, or the traditional concepts of acupuncture meridians. Now if you look at the acupuncture meridian map, and you look at a map of the peripheral nerves of the body, you see the meridians line up quite closely with the peripheral nerves of the upper and lower extremity. So we're going to transition into the concept of neurological acupuncture. And for our topic here about lumbar spinal stenosis with intermittent claudication, we're going to look at the acupuncture points of the lower back, the legs, and the feet. And you'll see that acupuncture meridians of the back and legs follow closely the sciatic, peroneal, and tibial nerves. And we're going to look at some studies which show stimulation of these specific acupuncture points have been shown to increase blood supply to the nerve roots. Taken together, these facts suggest that acupuncture and acupuncture-like stimulation would be a perfect treatment for patients suffering from lumbar spinal stenosis.